Okay, thank you. I have no disclosures. So we know there's a robust association between nocturia and a variety of cardiovascular diseases, including heart failure, hypertension, and coronary artery disease. With respect to management, from our country, the big governing bodies, the American Heart Association and American College of Cardiology, say take it easy with that salt shaker. They recommend dietary salt restriction for the primary management of these conditions, as well as for prevention of cardiovascular disease. Importantly, some recent work from Dr. Matsuo and colleagues in Japan has shown that dietary sodium is an independent risk factor for nocturia, and consistently, sodium restriction improves nocturia severity. However, this was in a group of inpatients, and we don't really know if these results are generalizable to other populations with nocturia. Accordingly, our aim here was to test the hypothesis that adherence to sodium counseling recommendations in accordance with best practice standards for the management of cardiovascular disease reduces nocturnal voiding frequency in patients evaluated at an outpatient cardiology clinic. This was a retrospective chart review of patients at a university hospital-based outpatient cardiology clinic from 2015 to 2018. Included were adults with one or more nocturnal voids at baseline in whom dietary sodium restriction were warranted. This involved a sodium intake interview and individualized treatment plan from the patient's cardiologist in accordance with best practice standards, and adherence was assessed by the same practitioner at routine follow-up. The practitioner also recorded baseline and follow-up self-reported or patient-reported average nocturnal voids. In total, we had 94 patients. They were a majority female, predominantly African American, with a high average BMI, and not shown here, but high degree of concurrent comorbidities. We had follow-up data and multiple follow-up data from more than half the cohort. Our main finding was that in these patients, after dietary sodium advice, we saw nocturia frequency decrease from baseline to 2.9 voids on average to 2.0 voids at first follow-up, and then subsequently further decreased to 1.7 voids at second follow-up. So our main takeaway from this is that sodium restriction in accordance with dietary counseling, best practice standards for the management of cardiovascular disease, improves nocturnal voiding frequency. Accordingly, this might represent an important adjunct therapy for patients with concomitant nocturia. And I'll take any questions.
Questions or comments? So what's the average recommended intake again for the U.S. population for dietary standards?
I don't know the exact number off the top of my head. So the one limitation of this, we were not able to quantify exact sodium intake.
So this was just restriction. Everybody restrict their sodium, is that?
Yes, and it was assessed by the same practitioner at baseline and follow-up. So although we couldn't quantify exact amounts of sodium, we thought we had, he took very detailed chart notes, and we felt like we were able to assess whether they were adherent or not from the chart.
Yeah, I mean, that's like a wow, right? Because that's better than you get with any drug that I know of, right? I mean, anybody have a better drug than that? I don't think so.
Yeah, thanks very much for this work. It's obviously you have to say that this is in the trials we compare to the placebo, and here this is without compare.
Excuse me, may I have a comment?
Yeah, go. Give me 1 second. So did you have a decision aid or something like? How did the person do this? Because she or he has done a very good job. Mm-hmm. It's not something what any urologist or any healthcare provider can just do. Did a lot of training or decision aid, or how did it do the intervention?
So this was a individualized sodium counseling. It took on average 20 to 30 minutes from the provider, who is a cardiologist by training, but has a master's of public health and significant nutritional background.
Yeah. Okay, sorry. Microphone 1, please.
So Just a quick comment, like, these patients are coming back to the cardiology clinic. They have a pretty good follow-up. Is there a way we can differentiate between, because we cannot say if their sodium intake changed after the counseling versus was it just good care, good overall medical care that the patient did? Were they more compliant with the medications, and it's the effect put all together that improved the outcome?
Sure, I'm happy you asked that question. We broke it down further, looking so that was the results I reported were from all patients. And when we broke it down into actually those who were adherent and those who were non-adherent, we saw about 2/3 were adherent, and it followed very closely. Patients who were adherent with dietary sodium restriction saw a decrease in nocturnal voids. Those who were not did not. And the effect was even bigger when we looked at just the adherent patients.
Yeah, and the actual Japanese study in the 2 articles that were first authored by Matsuo, they actually measured it. And so the salt decrease in the favorable group went from 10.7 grams to 8 grams, which is what they recommended. And the Nocturia was almost exactly like yours. After a while, it went from 2.3 to 1.4. And the ones who didn't decrease, they actually increased their intake from 9.6 to 11, and they went from 2.3 to 2.7. So it would appear that everything you said is absolutely correct.